All right, good morning. How's everybody doing today? I think it's a
Morning.
beautiful
Good
morning.
morning.
Good morning. I think it's a beautiful morning. I'm ready for some rain. If we got to be locked inside, we may as well water the grass. So, good morning, everybody. Today, as you may have guessed, we are going to be talking about pharmacology today in MindTap. Pharmacology is found at the very, very bottom of the list. I know that you guys can view all of that stuff within MindTap, but I also threw in a PDF. It's just a little bit easier to see and print. It's the same material as what MindTap provides you. But I've given you guys a PDF. I will warn you, it is a little thick, a bit of a packet. It's about 60 some odd pages, front and back, but it looks like this. And it covers all the information that you guys will need for the pharmacology section. We are going to go through this together. If you don't already have it printed, then grab a notepad, go grab paper and a pen if you don't have it already, because you guys are going to need to take a lot of notes. So if you guys are listening to the recording, go ahead and pause it right now. Go grab a pen and paper. Make sure you got plenty of papers because you guys are going to need quite a bit of notes. I'll also be trying to help you guys spell some of these words as well. So when we have, big words like hydroxyquinone, I'll write them on the board for you guys that are watching. I'll try to spell them out loud for you guys who are listening. But we are going to go ahead and get started with the pharmacology handout. And we start with talking about the purpose of pharmacology education for massage therapists. Now, we all are pretty familiar with the fact that we are not doctors, right? We cannot diagnose diseases. We cannot prescribe medications or treatments for those conditions. So why does a massage therapist need to have an understanding of pharmacology? Well, we are, after all, putting our hands on the human organism, creating some kind of change within the body for therapeutic results. So if they are putting chemicals in their body, like drugs, in order to treat or suppress some kind of condition, we need to understand what drugs they're on and what effects those drugs have on the body. That way we know that we're not doing anything that could be potentially harmful to a client, anything that may aggravate a condition, or anything that may affect the way that the body is going to absorb and metabolize those drugs. And if you think massage can't affect the way somebody metabolizes a drug, I'll give you one quick off the top of my head example. Many people get intramuscular injections. This is they're going to be injected with a very thick syrupy liquid that is injected in between muscles, and the medication sits there for several days, slowly being absorbed into the bloodstream. If you start massaging that area, you're going to increase the rate that that drug is taken into the bloodstream. So if this treatment is supposed to give them, I don't know, less pain for a week, and we increase the rate of that drug's absorption, we may cut down the amount of time that they live pain-free. So they need another injection sooner. That's just one example off the top of my head. But let's go ahead and start with the pharmacology packet. Right on page 1, it talks about the purpose of pharmacology and the role of the massage therapist regarding patient medications. So often, the things that a client is complaining about to us aren't a result of the disease itself, but may be a reflection of the side effects of a medication that they're on. It could also be side effects caused by interactions between two different medications, or interactions between medications that they're on and supplements that they're taking. So let's move on to the next page. It's important that we get a list of the medications that a client is prescribed. This will always be found on any intake form. It will ask them for their conditions, any previous surgeries, and any medications that they're on. There's a few things that we need to make sure that we're looking out for. Now, before we jump into all of this, really, I just want to make it clear to everybody, we are not expected to know every drug and know every side effect and be able to list every drug category and lists of drugs. That's for pharmacists. That's for pharmacologists. That's for physicians to deal with. What we are concerned about is understanding major drug categories right? The major types of drugs, what those drugs treat, and we can name a couple of examples, usually through everyday life, that we have come in contact with just from living in a human body and being sick from time to time. But it's important that we get this information from clients before we begin the session. Not only is it important that the client has informed consent, but we also need to gather informed consent for ourselves so that I can consent to perform this massage, that I know the massage that I'm performing will not be causing any harmful side effects to the client. So make sure that you're using your client intake forms. Make sure that you get a list of their medications, the dosage that they're on, how many times per day are they taking it, why are they taking this medication. Many medications will have multiple uses or so-called off-label uses. For example, many anti-seizure drugs, you would think that anti-seizure drugs would be prescribed for epileptic patients, but a lot of people are prescribed them for simple headaches. So the reason that they're taking the medication can be different from person to person. And we also need to know the duration. How long have you been on this medication, right? Most people are only on antibiotics for a week or two. Some people are put on blood pressure medication for years. So how long have you been prescribed this medication? All right. So let's take a look at the word pharmacology. What does pharmacology mean? Well, this is a science that studies the effects that substances have on living organisms, the nature of their chemical structure, how they act within the body, and how the body responds to them. So we could essentially boil this word down. The ending ology means study of or science of, and the root pharmac or pharmaco comes from the Greek word pharmakon, which means drug. So pharmacology is literally the science of drugs or the study of drugs. So we are looking at the chemical composition of the drugs, how they create change within the body, how the body responds. So how does the body metabolize that drug? How do we get rid of it once it's done its job? Now, when we use the term drug, this is a very, very broad term. Most people jump straight to the illegal drugs, right? Marijuana, cocaine, heroin, LSD. We jump to the illegal things. But guys, drugs are simply anything that creates some kind of chemical change in the body. So we could be talking about caffeine or alcohol. We could be talking about Tylenol or Advil or aspirin. So the word drug is kind of a double-edged sword, right? We start leaning towards the illegal stuff, but pharmacology is the science of all drugs. Generally, we are looking at the medical type drugs that you can either buy over the counter or the drugs that are available by prescription. So whatever the origin of the drug, there are a few things that drugs will have in common with each other. Number one, they will affect the body in some way and cause cellular changes to take place, which will have an effect on the body's physiology. So there we go. Number one, effects of drugs creates a change in the way the body works, causes cellular changes to take place. So drugs change how cells function, which in turn leads to an effect on the body's physiology. It affects the body's physiology. Some drugs will affect the entire body. And if we think back to when we talked about contraindications for massage, we talked about systemic contraindications, meaning the entire body is contraindicated. We do not touch them at all. If a drug has a systemic effect, it is affecting the entire body. Other drugs are for local use only, and they are limited to one area of the body. So a drug that is limited to one area of the body, Abreva, we put it on our cold sores. A drug that affects the entire body, blood pressure medication, aspirin, blood thinners. Another factor to consider is the client's age. Age will have a different, or will cause drugs to behave a little bit differently. Children need generally smaller doses of a drug. Heavier people will need heavier doses of a drug, so the size of the client is a consideration. Elderly people metabolize and excrete drugs much more slowly than the average population, so many drugs are eliminated through the kidneys. So as you age and your kidneys start to wear out, it can take longer for drugs to metabolize out of your system. So the elderly population is one concern. Children is a concern. The weight of the client is also a factor. Heavier people need larger doses of a drug than thinner people. Women, men, people of different races, people in diseased states, they don't always respond the same way to medications. This would owe to differences in things like hormone levels and body metabolism. So generally, drugs will be contraindicated if a woman is pregnant or nursing, because when we do drug tests, we almost always test on white men. I know, it's lame, but we test generally on populations of white men, so we don't get a lot of data about how these drugs affect women or people of color or people that are already in some kind of diseased state. So when we are prescribing medications to women, if they are pregnant or nursing, we generally avoid prescribing them because we don't have a lot of studies that show what those drugs' effects will be on either the unborn child or on the newborn baby if the mother is nursing. Everybody good so far? Good stuff? Good stuff. Okay. So the next thing we're going to talk about is how drugs are named. Anyone who knows anything about drugs knows they come up with some ridiculous names for these things, right? These words are like a half a mile long. But if we know anything from studying medicine and anatomy, especially if you've ever had me as a teacher before, you will know that my mantra is never be afraid of large words. Big words are tools. They are not our masters. Most of these words can be broken down, but we come up with a lot of different names for the same drug. This has to do with reasons of proprietary, what's the word I'm looking for? Proprietary patents. I'm talking about patents, ownership. If you create a drug and you put a patent on it, that drug belongs to the company and you can put a brand name on it. So we give it a brand name. After a few years, the patent wears off, then we give that drug a generic name, and then we also will give a drug like a pharmacological name. Let me give you a couple of examples of these and just to illustrate what I mean. So when we talk about a brand name, right? To give you an analogy, you guys are all familiar with something like Kleenex, right? Kleenex, the facial tissues. But Kleenex is a brand name. There are many different brands of facial tissue. There is only one brand called Kleenex. But we almost use the word Kleenex generically to refer to any kind of facial tissue. Same thing with Band-Aid. Band-Aid is a brand of adhesive bandage. Many companies make adhesive bandages. There is only one company named Band-Aid. But it's so synonymous with its product that almost every adhesive bandage is called Band-Aid. So this is what we mean by a brand name. We are talking about the same kind of product, whether it's an adhesive bandage or whether it's a hot tub, right? We call them jacuzzis. Jacuzzi is a brand name for a whirlpool bath. So when we talk about brand names, we're talking about names like Tylenol. We're talking about names like Aleve. Now, these drugs are brand names. So almost anything that you pop for a fever or general pain relief, oh, it's called Tylenol. Well, no, Tylenol is one specific drug. It is acetaminophen. And I will spell that for you guys. Tylenol, the active ingredient is called acetaminophen. It is spelled ACETOMINOPHEN. That was a really long word. Acetaminophen. Many, many different drugs use acetaminophen as their active ingredient, right? Motrin, Tylenol. There are many different drugs. Tylenol is a brand. Acetaminophen is the generic name for that drug. Tylenol would be a brand name. Aleve is another example. Active ingredient in Aleve is ibuprofen. 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 Ibuprofen is the active ingredient in Aleve. It's in Motrin. It's oh gosh, I would have to pull up a list. But guys, seriously, there are tons of medicines that use ibuprofen as their active ingredient. So we have here generic name. We also have a brand name. Now, who comes up with the names? Well, usually the drug company, the company that created the drug. So different drug companies or major pharmaceutical companies, you may recognize some of these names from the news. We're talking about companies like Bayer, right? Bayer aspirin. We're talking about companies like Eli Lilly. Eli Lilly is 2 L's. Eli Lilly, E-L-I-L-I-L-L-Y. We're talking about companies like Pfizer. We're talking about companies like Merck Chemical Company, Johnson & Johnson, AstraZeneca, GlaxoSmithKline. If you've watched any of those drug commercials, right, where the old couple's walking through the woods talking about how happy they are now that they got some pill for something, at the end, they always tell you the name of the manufacturer. Eli Lilly, Pfizer, Bayer, Novartis, Merck & Company, Roche Holdings, Johnson & Johnson. These guys are major pharmaceutical companies. So the naming of a drug is often not only based on its chemical composition, so there's one way, chemical composition is how we name a drug, but number two, we name it based on marketing. That's the brand name, right? That's where we get names like Tylenol or, no, I had one, hold on. Viagra. Viagra is a brand name, right? The medical name for Viagra is like sildenafil citrate or something like that. But so we give things a name based on their chemical composition. That would be the sildenafil citrate. Then we give it a brand name based on marketing. That's like Viagra. So we should be familiar with the different names for the same medications. In the same way that facial tissues can be Kleenex or Scott's or Puffs, anti-hyperlipidemic agents like atorvastatin calcium, fluvastatin sodium, lovastatin, pravastatin sodium. These are all respectively known by brand names like Lipitor or Altacor or Mevacor, Zocor. So this appendix gives you lists of all of these things. Remember, this is meant to be used as a reference. This is not meant for you guys to like memorize a list of drug names. That is not the purpose of what we're doing here. Okay, I just want to give you guys take a deep breath and calm down because you are not going to be asked to memorize lists and lists and lists of drug names. So moving on to our next topic, how drugs are classified. Well, there are many different ways that we can classify drugs, but generally we classify them based on the kind of effect that they have. Now, many drugs will have multiple types of effects, so it is not uncommon to see the same drug listed under multiple categories because that drug will have multiple uses. For example, aspirin. Everybody probably has a bottle of aspirin in their medicine cabinet. Aspirin, there we go. Words are hard, sorry. Aspirin is usually used as a pain reliever, which means it is an analgesic. The word analgesic, an means without, algia means pain. That ending ia is a condition. So analgesia is a without pain condition. It's a pain reliever. So we take aspirin when we're in pain. But many people also take aspirin when they're running a fever. So another effect of aspirin is that it lowers your body temperature. It lowers a fever. Those medications are called antipyretics. Anti meaning against. The root py or pyre, if you've ever heard of a pyromaniac, pyre means fire. So antipyretic are anti-fire medications. They lower a fever. So we would see aspirin now in two categories, the antipyretic category and the analgesic category. But wait, there's more. Aspirin also reduces inflammation, so it is an anti-inflammatory medication as well. So we can see one drug being found in 3 separate categories. This is common. Additionally, we could also classify drugs based on the origin of that drug. So where did the drug come from? We generally identify 3 origins for drugs. And those origins are chemical origin. Chemical origins are synthetic drugs. They are created in a laboratory. These would be things like tramadol or Dilaudid. If you guys have, anyone ever gone to the hospital to get Dilaudid before, it is a synthetic morphine. So it's an opioid like morphine, but it's completely created in a laboratory. It is incredibly strong painkiller. It is by prescription only. It's got to be injected by a medical professional. But drugs of a chemical origin, these are synthetic. They are created in a laboratory. The next category is botanical. Any savvy observer note the root word in the word botanical? Botan, like botany, study of plants. Botanical-based drugs are sourced from plants. So we are using plant-based medicines. Now, this isn't herbalism or using herbs. What we're talking about is finding active ingredients within a plant, and then we extract that ingredient, purify it, and use that as the drug. A really, really good example of this, you guys, is aspirin. I don't know if you know where aspirin comes from, but the active ingredient in aspirin is salicylic acid. Yes, my skincare peeps, the same salicylic acid we put on the face. Yeah, that stuff. Salicylic acid is sourced from willow tree bark. Fun fact. So now, does that mean you can go grab willow tree bark and chow down on it and, get rid of your headache? No. Salicylic acid is found in very small amounts. Willow tree bark will have some medical application, but when we're talking about botanical drugs, what we're talking about is taking that active ingredient, purifying it, extracting it, purifying it, and then we combine it with other ingredients to make it a shelf-stable pill. So, there's your example for botanical. Salicylic acid, also known as aspirin. The third place that we can source drugs is animals. So animals give us a lot of drugs and drug uses. One very clear example, antivenom. If you get bit by a snake, we have to give you antivenom. We make the antivenom by using the venom from that snake. So when you see those videos of people milking the snake, right? They hold its head and they have it puncture like a rubber cap on a jar, and they collect its venom. It's being used to make antivenom. That drug has an animal source. Another example, insulin. If any of you guys know anybody who is diabetic, that is an insulin-dependent diabetic, that insulin is sourced from pigs more often than not. So there we have the 3 drug origins: chemical, botanical, and animal. We get them through laboratories, through plants, or from animals. All right. Any questions so far before we move on? All righty. All right. So next up in your guide is this humongous table of drug categories. Again, this is a reference. This is not something you are meant to memorize. So read it over, glance at it, pick a few names like, oh, I've heard of that one. Oh, I've heard of that one too. And then we're going to move right along. All right, we're going to skip ahead. This is a really long chart, you guys. All right, we're going to skip ahead to page 18. That chart took like 14 pages, by the way. So we're going to skip past that chart. The next area we're going to start on are drugs to treat the skin. So here is going to be the format for the rest of this lecture. We are going to take a medication area like the skin or pain or fevers, something like that. We're going to talk about different categories. We will be naming different drugs. Make sure you guys are writing these names down. And I will give you like the highlights. I will read them out to you so you can write those highlights down. So first we're going to talk about drugs that are used to treat the skin. So almost all of these are going to be some kind of topical medication like a lotion or an ointment. The first category we are going to look at are called antipyretics. Antipyretics is spelled Antipyritics. Antipyretics are used to relieve allergic reactions that cause rashes and itching. So rashes, itching, allergic reaction. So here's an example, Benadryl. Anybody ever popped a Benadryl in their day? Anybody ever popped a Benadryl to their kid to get some sleep at night? I won't tell if you won't. Another example is Cortaid. So these are used for local anesthetic, so local pain relief, the pain and itching of a rash. It could dry things out. So for a rash like poison ivy, you got to put calamine lotion on, dry out the rash. They would also contain anti-inflammatory agents to reduce inflammation. And those anti-inflammatory agents would be something like corticosteroids or antihistamines. So the highlight from here, though, we have antipyretics, relieve rashes, itching due to allergic reaction. Good example, Benadryl. Benadryl. Now, I mentioned a moment ago corticosteroids. There's our next drug category. So corticosteroids, this first word cortic or cortico, if you're thinking about the hormone cortisol released by your adrenal glands, you're on the right track. Corticosteroids can be used locally or systemically, and they're used to treat allergic reactions and inflammation. They're also used topically, which means on the skin like a lotion, to treat eczema, psoriasis, and dermatitis. An example of a corticosteroid would be Cortaid. Cortaid, Cortaid. Good stuff? All right, the next category we are going to talk about, and guys, we're going to be moving through these categories kind of quickly. So if I'm moving too fast and you're still taking notes, please reach out. Tell me to stop. I will hold up for you guys. No problem. The next category of drug we're going to look at are called keratolytics. 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 This first part of the word carrot or kerato, if you're thinking that sounds a lot like keratin, you are on the right track. This suffix lytic means to dissolve or to break up, right? So like mucolytics break up mucus in your chest. Keratolytics are breaking up keratin. When would I ever need to break up keratin? Dandruff. We're talking about things that are used to treat flaking of the skin, like dandruff or psoriasis. These drugs catalyze the peeling of the skin. So if you have conditions like acne or calluses or corns or dandruff or something like that, keratolytic medications cause the skin to break up those keratin flakes, which reduces the flaking on the skin. So two really good examples of keratolytics, Neutrogena. right? That really harsh face wash that estheticians tell everybody never ever to use ever. Um, Another example, in addition to Neutrogena, Clearasil. Yeah, that face wash. These are keratolytics. So Neutrogena, Clearasil. The next category of drug we're going to look at are called antifungals. I will give you 3 guesses as to what antifungals will treat. It's okay, I'll wait. Antifungals are used to treat fungal infections. I know, I'm blowing your minds right now. Fungal infection examples include things like candidiasis. This is an infection of the Candida fungus. It's a yeast, I believe. So this would be something like a vaginal yeast infection. You could also have aphthia. Aphthia is the medical name for thrush. You guys heard of thrush? It's a throat infection. You get like these white patches in your throat. Ringworm, another example of a fungal infection. Ringworm, also athlete's foot. So antifungal medications are used to treat fungal infections. We're talking about drugs like Lamisil or Monistat or Tinactin, right? Tough actin Tinactin. Another category of drugs are antibacterials. And again, the name is telling you precisely what you need to know. Antibacterials treat bacterial infections. Great classic example you guys all have in your medicine cabinet, Neosporin, right? You get a cut or a burn, you put Neosporin on it so that it doesn't get infected. That is an antibacterial medication. Another example is Bactitracin. Bactitracin, Bactitracin. All right. Moving on to our next category. So this is everything we're talking about for drugs used on the skin. The next category we're going to look at are musculoskeletal and anti-inflammatory drugs. And we cannot even begin talking about musculoskeletal and anti-inflammatory drugs without talking about the most common and most popular class of medications. I'm talking about NSAIDs. NSAIDs. This is an acronym for non-steroidal anti-inflammatory drugs. NSAIDs. Non-steroidal anti-inflammatory drugs. So what are NSAIDs? Well, they're anti-inflammatories and they're not steroids. Ta-da! Non-steroidal anti-inflammatory drugs are extremely common. These are almost all of your over-the-counter pain relievers. Tylenol, Aleve, aspirin, Advil, all those fun things. So the first one that we're going to look at, I'm actually going to have to skip around just a little bit. I'm going to skip around a little bit. I got one just kind of stick just before NSAIDs, and then we're going to come back to these. But the first one on the list is skeletal muscle relaxants. I think we have all heard of muscle relaxants, and we are pretty familiar with what they do. Skeletal muscle relaxants are used to treat pain, spasms, and muscle contractions, as well as restricted range of motion. Muscle relaxants treat pain, spasms, and muscle contractions. Or not contractions, I'm sorry. Nope, that says muscle contractions. Two examples of your skeletal muscle relaxants: Flexeril, Flexeril, and Valium. All right, so moving back to our NSAIDs. These medications are used to treat inflammatory conditions like arthritis, bursitis, gout, muscle strains. Um, Symptoms will include inflammation, pain, swelling, heat, loss of range of motion. So for any of these reasons, we would generally pop an NSAID. There are a newer class of NSAIDs. See, generally with NSAIDs, part of the risk is that they cause GI bleeding. So you're not supposed to stay on these medications for too long. So if you're popping Tylenol every single day, number one, it's really, really hard on your liver, for one thing. So most people would switch to ibuprofen. Well, ibuprofen is really hard on your kidneys. So you got to kind of pick one. And it takes a while for the rest of the drug to break down, which leads to bleeding in your GI tract. But they recently developed a new class of NSAID called COX-2 inhibitors. I'm sorry, OX2 inhibitors. That's OX-2. OX2 inhibitors. So these have less of a risk of GI bleeding, but they pose more of a risk for heart disease and stroke. So NSAIDs can cause GI bleeds with prolonged use, right? So I'm not talking about take one and your gut explodes. I'm talking about people who are taking 6 or 7 or 8 ibuprofen a day for months and months and months. OX2 inhibitors have a less chance of GI bleeds, but they also increase risk of stroke and your risk of heart disease. So, some examples of NSAIDs. As I said before, Motrin, Advil, Nuprin, Aleve. A lot of your over-the-counter pain meds fall under this category, this non-steroidal anti-inflammatory drug. Okay. Moving swiftly along, the next category is for gastrointestinal medications. If the client complains of GI problems, medications are going to be one of the first things we want to talk to them about. Any kind of issue with their GI tract, I got to know what medications you're on. Many medications will affect the GI tract in some way. Oftentimes, their GI complaints stem directly from the drugs they are taking and less from some illness or disease. So make sure that GI complaints we're addressing them. What medications are you on? One of the most commonly used medications for the GI tract are antacids. Antacids. Antacids, or are, if you look at this word, acid, these are against acid. These neutralize the hydrochloric acid that is in your stomach. These are among the most widely purchased over-the-counter medications. They're used to treat indigestion, heartburn, sour stomach. The way that these work, anybody who's familiar with the pH scale, if your stomach is very acidic and we throw in an antacid, what must the antacid be? Somebody? Alkaline. It's got to be alkaline if it's going to neutralize acid. So your stomach acid is a pH of 1. Antacids like Alka-Seltzer or Tums will have a pH of around 10, somewhere around in there. So very alkaline. And when the two come together, they neutralize. So you don't get that upset stomach anymore. Good examples of antacids: Tums, right? Tums. Malox, another good one. Mylanta. Oh, Mylanta. All of these are antacids. Now, antacids can be used to treat heartburn, which is when the cardiac sphincter is a little weakened and some of the gastric acid escapes up into the esophagus. The lining of the esophagus is not as tough as the lining of the stomach. So that really harsh acidic stomach juice can wear away the inner lining, causing more prolonged damage. We would usually use a different drug, a stronger drug, to treat chronic heartburn. So antacids are just not up to the task. They can deal with you when you get heartburn kind of in spells. But if you have chronic heartburn, which can lead to gastroesophageal reflux disease or GERD, this is chronic acid reflux, we would use a stronger drug, something like Zantac or Pepcid. Zantac is spelled Z-A-N-T-A-C. Pepcid, P-E-P-C-I-D. Again, these two drugs are used to treat GERD, which is gastroesophageal reflux disease. This is chronic heartburn. If your GERD is a little bit more intense or a little more difficult to treat, there is another category of drugs we could use to treat esophageal reflux disorders. These drugs are called proton pump inhibitors. Proton pump inhibitors. Proton pump inhibitors prevent stomach juices. They prevent gastric secretions. These are meant for short-term use if you're treating something like GERD or ulcers, you have stomach ulcers. And some examples of proton pump inhibitors would be something like Prevacid or Nexium. Prevacid is spelled P-R-E-V-A-C-I-D. Nexium is spelled N-E-X-I-U-M. Again, these are proton pump inhibitors. Now we have a few more in the GI category, but I don't have any highlights for them. We're talking about things like anti-diarrhea medications or laxatives or antiemetics, which are used to treat nausea and vomiting, motion sickness. But I don't have any highlights for those, so I am going to move on. You guys, again, you have this PDF in MindTap, so you guys can read over it. We're going to move on to the next category, which is respiratory system medications and antihistamines. All right, so we are on page 26. The first drug in the respiratory system category we're going to look at are called bronchodilators. The name tells you what you need to know. Broncho refers to the bronchi, right? The air tubes that are within your lungs. Dilator means to make them larger. So a bronchodilator will make the bronchioles larger. Now, why would I ever need to go making my bronchi larger? Well, these drugs alleviate bronchospasms, like asthma attacks, by increasing the capacity of the lungs. If we can open up those airways, then we can get more air into the lungs with each breath. These medications are used to treat acute respiratory conditions. We're talking about asthma. We're talking about COPD, chronic obstructive pulmonary disease, COPD. The bronchodilators treat asthma, COPD, chronic obstructive pulmonary disease. There are three types of them, but the only one that I really want to pull your attention to is albuterol. Albuterol is spelled ALBUTEROL, albuterol. By and large, you guys, if you think about the stereotypical like asthmatic kid who can't do sports and every time he gets winded, he's got to have this inhaler. The inhaler is the albuterol. It's a spray medication that they inhale and it opens up their airways. So when you think of albuterol, we're talking about an inhaler. The next category we are going to look at for the respiratory system are mucolytics and expectorants. Now, these two drugs kind of go hand in hand, although they do slightly different things. Mucolytics, if you look at the word muc or muco, we're talking about mucus. And again, lytic means to break up, right? To get rid of it. So mucolytics literally breaks up mucus. This liquefies pulmonary secretions. So the mucus that is being produced in your lungs, if it's too much, you have congestion. Mucolytics break up that congestion so that we can then get it out. Now, expectorants, on the other hand, increase secretions of the lungs, but they also make those secretions thinner, more watery, which helps get them out of the lungs, right? So the thinner the fluid is, the easier it is to cough it out. If the mucus is super, super thick and sticky, it's going to get stuck in the lungs. We can't get rid of it. So mucolytics break up that thick mucus and liquefy those secretions. Expectorants help reduce and thin it out and help to expel it out of the body. Expectorants are often combined in different cough syrups to help with coughs created by upper respiratory tract infections like colds, bronchitis, and that post-nasal drip, that mucus dripping in the back of your throat. Now, mucolytics, I love the name tells you what you need to know, right? Mucolytics, breaking up mucus. But expectorants isn't really intuitive of a word, but I do have a trick for you guys. I don't know how many Disney princesses I have in the audience, but are any of you guys fans of the old Disney cartoon Beauty and the Beast? Yeah, Beauty and the Beast. Do you remember when they introduced Gaston and he's singing his big song and he's like, oh, Gaston's so awesome, and he's like, I don't know, a good hunter or whatever. But there's one line in that song where Gaston is like, I'm especially good at expectorating, and then Patooey spits into a thing. Expectorating is like hawking it up, like that. That is expectorating, right? It's like hawking a loogie and spitting it out. So expectorants help you hawk a loogie so you can get it out of the lungs, right? The mucolytics broke up mucus. The expectorant helps you expectorate or cough it up. Didn't think Gaston would make a guest appearance in a pharmacology class, but there you go. All right. We do have a couple of more examples, but I don't have highlights for them, so we're going to move past them. The next one that I have for us is on page 27. We are looking at decongestants. Decongestants, well, what do? Well, they decongest. They constrict blood vessels, they make them smaller in the respiratory tract, which helps shrink swollen mucous membranes. Decongestants constrict blood vessels in the respiratory tract, helping to shrink swollen mucous membranes. They open the nasal and sinus pathways. A great example of a decongestant, Sudafed. Sudafed, S-U-D-A-F-E-D, Sudafed. Okay. Any questions so far, you guys? Okie dokie. Real quick before we move on. Caller 1, can you tell me what your name is? I want to make sure you get credit for being here today. Who is caller number 1? Who is you?
I'm pretty sure that's Chelsea.
Chelsea Marcinek?
Oh, no. Louis. Louis? Louis?
No, Lois, I see you. Lois, I have your name here. I see Adriana, I see Lois, I see Sky, I see Nando, Janice, Sandra, Questy, Bobby Joe, Carla, Coral, and caller 1. I need to know who caller 1 is so I can make sure you get credit for being here today, you guys.
It could be David. I know he was trying to get into the chat.
David, okay. All right, so who is caller 1? Somebody will respond to me. Okay. We're going to move on. The next category of drugs we're going to be looking at are cardiovascular medications. Now, guys, I hate to break it to you, but we live in Florida, and most of your clients are elderly, and most of your clients will be on cardiovascular drugs. So pay attention. There are many different categories of cardiovascular drug because there are many different things that can go wrong with the heart, things that we would need to then correct. So some drugs are used to strengthen the heartbeat. Like if you have congestive heart failure, the heart isn't pumping enough blood, so the way it responds is to actually get larger so that it can, try to beat more strongly. We would give them cardiotonic drugs to strengthen the heartbeat. Another type of medication are antiarrhythmic drugs. I'm going to write that on the board. Antiarrhythmic drugs. So antiarrhythmic drugs, this is one that is worth kind of breaking up and looking at. Anti means against. A means without. Rhythm. So against, without rhythm drugs. If somebody has a heart condition known as arrhythmia, the heartbeat is not regular, right? Their heartbeat is irregular. It doesn't beat in the normal lub-dub, 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 lub-dub. An irregular heartbeat would sound like lub, dub, lub, dub, lub, dub, lub, dub, lub, dub. If it's not a regular, strong heartbeat, then the flow of blood is going to be impaired. So we would want to correct that lack of rhythm. We would want to correct that arrhythm with a drug that is against that that without rhythm. So antiarrhythmic drugs induce a regular heartbeat for patients with arrhythmia. Most of these medications lower the blood pressure and slow the heartbeat. So we've got to prescribe, those medications are prescribed with a lot of supervision. There are many groups of antiarrhythmic drugs. The main ones that we are going to look at are called beta androgenic blockers. And these are often shortened to beta blockers. The Greek letter beta. It looks like a B. So beta blockers will, again, suppress the blood pressure. They will slow the heart rate, which allows the heart to create a more regular rhythm. Next group we're going to look at are called antihypertensives. So hypertension is the medical name for high blood pressure. High blood pressure is a very common condition in the United States. So many people have this condition and are going to be put on antihypertensive medications. Some of them are very common. A couple of examples. One good one is lisinopril. Lisinopril is a very common anti-blood pressure medication. It is very common because I know one of the more commonly prescribed ones, because I know a lot of places will offer it for free, like Publix gives lisinopril away for free if you have a prescription, or it's like $5 or something. That's really cheap. Lisinopril is spelled Lisinopril. Antihypertensives lower high blood pressure. One example, lisinopril. Another category of drug used to treat high blood pressure, also used to treat congestive heart failure, are called ACE inhibitors. ACE stands for angiotensin converting enzymes. Let me write that down real quick. Angiotensin. Angiotensin converting enzyme. Angiotensin is spelled angiotensin. Angiotensin converting enzyme. These drugs, again, are used to treat congestive heart failure and high blood pressure by decreasing vasoconstriction. So these guys open up the blood vessels, increasing circulation of blood. Yet another category of drugs used to treat heart disease are anti-lipemic drugs. Anti-lipemic is another beautiful word. When we break it down into its component parts, it tells you a lot about what this drug is going to do. So anti tells us it is against something, so it is stopping something from happening. The root lip, L-I-P, like lipo, Lipo means fat. The next part, em, means blood. So it is anti-fat blood. Anti-lipemics reduce the amount of fat that is in the blood. When we talk about fat in the blood, guys, we're talking about cholesterol. These are anti-cholesterol drugs. These medications are among the most frequently prescribed. They are used to lower blood cholesterol and the low-density lipoprotein, the bad cholesterol. Clients who have high cholesterol are at a greater risk for heart attacks and atherosclerosis, the hardening of your arteries, especially in the coronary artery. There are 3 types of these drugs. They include statins, niacin, and bile acid sequestrants. The one that I really want you to really remember for anti-lipemics is Lipitor. I'm sure you guys have heard a commercial or something for Lipitor. Lipitor, L-I-P-I-T-O-R. Now, again, you guys, there are many medications that treat these different things. We are just giving it a very basic run through. Right. More categories of circulatory or cardiovascular medications. We have anticoagulants. Anticoagulants, anti meaning against, coagule or coagula means to coagulate or clot. So anticoagulants reduce blood clots. They thin the blood so that it does not clot. These are referred to as blood thinners. So super common blood thinner is a drug called Coumadin. C-O-U-M-A-D-I-N. Coumadin. Very commonly prescribed blood thinner, especially for people who have had heart attacks or have had to have stents placed into their blood vessels. You don't want blood to clot around those stents, so you put a blood thinner in there and now the blood doesn't clot. But there's a side effect. If your blood doesn't clot, that means anything that breaks the skin that causes you to bleed, your blood doesn't clot. So you just keep bleeding. People who are on blood thinners bruise very easily. They also bleed very freely anytime their skin is broken. So even a relatively small cut could cause quite a bit of blood loss. Now the next category we have here are the antithrombolytics. Anti meaning, again, against. Thrombo referring to a thrombus, a blood clot. And again, this word lytic meaning to break up or get rid of. So antithrombolytics break up clots that have already formed. So if you already have blood clots, they would give you antithrombolytics and it would dissolve those blood clots so that they do not cause any further damage. So this could be useful for people who have had strokes. This could be useful for people who are post-surgery. This could be useful for a lot of people who have any other kind of clotting disorders, surgery, knee replacements, things like that. Next category we're going to talk about are platelet inhibitors. As the name implies, they inhibit the function of platelets. If you guys remember, your platelets are responsible for blood clotting. So these medications are going to be used prophylactically. Here is a keyword for you guys. Prophylactically, P-R-O-P-H-Y LAC. Let me spell it. Profil LA. PROPHYLACTICALLY. Prophylactically. A prophylaxis is something that is used to prevent disease. You are not treating a disease that you already have. You are taking something to prevent getting a disease in the future, right? So just to give you guys a common example, an example of a prophylaxis is a condom, right? It is a prophylactic so that you prevent something from happening in the future, not treating something that has already happened in the present, okay? So when we are talking about platelet inhibitors being used prophylactically, what we mean is you're not diagnosed with a disease, you may be prone to it, so we're going to treat you now so that you don't develop the disease in the future. Platelet inhibitors are used to prevent disease. They decrease platelet clumping. They decrease platelet clumping. In clients having a recent history of stroke, heart attack, or peripheral vascular disease. I'm getting texts from students that didn't turn in work on time. They're like, oh, do these zeros count? Yeah. You didn't turn your work in on time, bro. I will say this group, you guys, my section Cs, you guys have been doing fantastic online with completing your online work and emailing it to me. Keep up the good work. You guys are doing amazing. Okay, so before we move on, do we have any questions over anything we've gone over so far? Okay. I still need to know who caller 1 is so that I can give you credit for being here today. All right, we're going to skip ahead to page 34 in our pharmacology packets. The next category was talking about urinary system medications. Well, we don't really treat urinary system. We're going to move on. The next one that is of relevance to us is the category known as anti-neoplastic drugs. This is a really, really good word, you guys. If you can't tell already, I love medical terminology. I think the concept of a designed language I just love it. Anti-neoplastic drugs tells you what the drug is dealing with. Anti means against, neo means new, and plastic, or the plasticity, is the ability to change. So when we are talking about medicine and we talk about something being plastic, we are saying that it is capable of undergoing change. So anti-neoplastic medications are against new changes. We stop creating new changes. What we are talking about here is cancer. Anti-neoplastic drugs are cancer drugs. We are stopping the mutation and growth of these cells that are either malformed or aren't maturing properly or are not dying on schedule like they're supposed to. Tumors are considered to be neoplastic, which means new growth. So anti-neoplastic drugs are anti-new growth, anti-tumor. They are both benign and malignant tumors. Benign tumors develop and then they stop and they sit right there. They don't go anywhere. They just develop. Benign tumors, you can live with them for years. They won't cause any problems. Many people will have them removed. But malignant tumors are the really bad ones. These are the ones that spread. If they get into the bloodstream or into your lymphatic system, they can spread cancer cells throughout the body. Tumors that are considered to be benign do not metastasize or spread from their original location. Tumors that are malignant, these are known as cancers, metastasize by spreading into adjacent tissues or into the bloodstream or into the lymphatic system. So when we're dealing with cancer, generally the kind of treatment that we will give is chemotherapy. Chemotherapy drugs are called cytotoxic, cytotoxic, cytotoxic. The prefix cyt or cyto means cell. The ending toxic means toxic. So a cytotoxic drug is a a cell-killing drug. They destroy cells, specifically cancer cells. Those are the ones that we are targeting with these cytotoxic drugs. Now, cancer is a huge, huge disease. There are so many different types and subtypes, which means there are tons and tons of different drugs to treat all these different cancers. So when we start looking at classes of anti-neoplastic drugs, there are dozens of different classes. One that I want to pull our attention to for the moment is hormone therapy. Hormone therapy consists of corticosteroids such as prednisone. Let me write these out for you. Corticosteroids such as prednisone. Prednisone is spelled Prednisone, prednisone. Hormone therapy also includes anti-estrogen drugs such as tamoxifen. Anti-estrogen drugs such as tamoxifen, Tamoxifen, and anti-androgen drugs. Androgens are male hormones. So like when we associate estrogen with females, androgens are the male hormones. Anti-androgen drugs, for example, Lupron depot. Lupron, Lupron, depot, just like the Home Depot, Depot. Do not ask me where they came up with that name. I do not know. I've got to die mad about it. But regardless of the category of drug that we use to treat the cancer, a lot of these cytotoxic drugs that we use to treat cancer, a lot of them have very similar side effects. Because they are killing new growth, remember that your hair follicles are new growth. So when we kill all of these new growths off, it often will lead to a side effect, a condition known as alopecia, Alopecia. Alopecia is the loss of hair while your immune system is attacking hair follicles. So oftentimes alopecia is a side effect of cancer treatment. However, it can also be an autoimmune disease. So some people just develop alopecia all on their own. They start losing their hair in patches. But commonly, alopecia is a side effect of the drugs that people are getting when they are undergoing cancer treatment. This is why cancer makes your hair fall out. You're taking drugs that are targeting new growth. Well, all your hair follicles is new growth, just constantly occurring new growth. So. All right. So the next category of drugs we are going to look at are drugs to treat the endocrine system. And again, the endocrine system is extremely complicated. If there is a hormone issue, there is not a lot that massage therapists can do to treat it. So while there are a lot of medications listed under the endocrine system in this packet, there's only a couple of things that I really want to pull our attention to. One is the category of thyroid medications. Thyroid medications treat diseases of the thyroid. They're used as replacement therapy for hypothyroidism. Hypo meaning below. So if your thyroid is not producing enough thyroid hormone, we could give you thyroid medications to up the amount of that hormone in your bloodstream. Hypothyroidism causes your metabolism to slow down. It gives you symptoms of fatigue, dry skin, weight gain, sensitivity to cold, and it can lead to irregular menstruation. So hypothyroidism causes slow metabolism, fatigue, weight gain, sensitivity to cold. All right. So I've got some information written up here for you guys. The next one that we're going to really look at is diabetes. Diabetes is a disease of the pancreas, which secretes hormones, which makes it an endocrine system organ. So diabetes is an extremely common disorder, but it comes in two types. And these two types have different causes, they have different side effects, and they lead to different types of treatment. So although the core problem is still the same, we get to this problem by two different ways. So these two conditions, even though they are both diabetes, they are different from each other. Diabetes comes in two flavors, type 1 and type 2. Let's start with looking at type 1. Type 1 diabetes is known as insulin-dependent diabetes. If you know a diabetic that has an insulin pump attached to their body, usually somewhere around their hip or so, this is also called juvenile diabetes because it is often diagnosed in childhood. The underlying condition here is a hypoglycemia. Hypo meaning below. Glycemia is a blood sugar condition. So type 1 diabetes is low blood sugar. Your body is not producing insulin, so you cannot absorb the sugar into your blood. This is generally caused by an autoimmune factor. Your immune system decides that the cells in your pancreas that produce insulin, those are the enemy, so we start to attack, and it cripples your pancreas's ability to produce insulin. So how do you treat this? You inject them with insulin. These are the people that have to take insulin every day to regulate their blood sugar. They got to prick their finger. They have to check their blood sugar. They may have to inject themselves. There's a whole kit that they have to carry with them everywhere they go. These people were generally diagnosed in childhood. It is a fault of their own body. It is nothing that they chose. It is not, anything that is not caused by eating wrong or anything like that. Type 1 diabetes or juvenile diabetes or insulin-dependent diabetes generally is an autoimmune disorder. So type 1 diabetes is hypoglycemia. Now, type 2 diabetes, like we said, is different. Type 2 diabetes is hyperglycemia. There is too much blood sugar. This is the non-insulin dependent. These people do not have to inject themselves with insulin. They have too much blood sugar. This one is the adult onset diabetes. Adult onset means most people are diagnosed with type 2 diabetes around the age of 40. Although, welcome to the United States with our fast food and low activity diets. People are being diagnosed younger and younger and younger with type 2 diabetes. We see people being diagnosed with diabetes in their teenage years or their early 20s nowadays. So type 2 diabetes has to do with lifestyle factors. It's eating too much food that is rich in sugar, refined sugar, too much carbohydrates, and then not enough exercise. So you're consuming all of this sugar, which is fine if you're going to burn it off, but if you're not burning off sugar, everything will be stored as fat. And when you consume high amounts of sugar, the pancreas has to work overtime to produce enough insulin to bind to that sugar to carry it into the cells. If the sugar cannot be carried into the cell, then it stays in the bloodstream. That is why it is hyperglycemia, a high blood sugar. Your cells can't just take sugar into themselves. They have to be bound with insulin. It's kind of like guys trying to get into a club. You don't get into a club unless you got hot chicks with you, right? You got to be with a girl to get into the club. Sugar cannot just enter the cell, right? The bodyguards won't allow it. You've got to be bound to insulin first. Well, if you eat an insane amount of sugar and your pancreas can only produce a small amount of insulin, then a lot of sugar is just hanging out outside the club. It's staying in the bloodstream and it causes a lot of problems. So type 2 diabetes, since it is caused by lifestyle factors, it is then reversible. So many people that, go on a diet, they lose weight, they exercise, type 2 diabetes can be reversed. You can revert to a non-diabetic state. Type 1 diabetes, on the other hand, this was an autoimmune disorder. All the diet and exercise in the world will not reverse type 1 diabetes. Juvenile diabetes gets you for life. Type 2 diabetes gets you for your lifestyle. So how do we treat these conditions? We would either give insulin, which is the most logical course for type 1. Type 2, we can give medications to help deal with side effects like the high blood pressure, but the only real way to legitimately treat the condition and not just treat the side effects, but the condition is a lifestyle change, diet and exercise. And I know everybody hates that, and I know everybody wishes there was some magic pill we could take, but the way that you reverse diabetes and lose weight is to eat healthy food, eat less calories, and move your muscles. Sorry about it. Okay. Everybody got all their notes for diabetes written down? Awesome. Okay, the next category we are going to look at are anti-infectives. So these are medications that prevent infection. Who knew? But with anti-infective medications, the important thing to remember is if someone is on an anti-infective medication, right, they're taking a drug to prevent themselves getting an infection, many of these people will be immunocompromised. Their immune system does not function properly for many, many different reasons this could be. But if their immune system is not functioning properly, we, the massage therapist, have to be very, very careful that we are not exposing them to an infection. So we cannot go to work if we are sick, if we have a cold, if we have the flu. I know that everybody is on lockdown right now because of the virus, but in the normal world, a lot of people go to work when they're sick. It's just the reality of the world we live in. As massage therapists, you may have clients coming to you that immunologically they cannot get sick. Their immune system does not work. It doesn't exist. It is beaten down. It's either beaten down by a disease that they have, or it's being kept down by drugs that they have to kill their immune system, like an organ transplant. So if a therapist is sick with a cold, you should not treat any clients because many clients could be immunocompromised. Now, the first group of anti-infectives that I'm going to talk about, and I think, yeah, the only one that I'm going to talk about, as a matter of fact, are penicillins. Penicillins, P-E-N-I-C-I. There we go. Sorry, I forgot how to spell for a second. Penicillins. Penicillins. Penicillin was a antibiotic that was synthesized about 100 years ago using fungus that grew on moldy bread. It was a breakthrough, you guys. It treats many strains of bacterial infection like streptococci, staphylococcus, and meningococcal infections. This would also include respiratory and gastrointestinal infections. Penicillins are the preferred antibiotic for treating gonorrhea and syphilis. Amoxicillin has been used to treat stomach ulcers caused by H. pylori bacteria. Some semi-synthetic penicillins have a broad spectrum of activity, but the main takeaway is penicillins are antibiotics, number one. Which means they are used to treat bacterial infections. Remember, antibiotics do not work on viral infections. So if you have a cold or the flu, antibiotics will not work. If your doctor prescribes them to you, you need a different doctor because he clearly does not know what he is doing. A cold and the flu will not respond to antibiotics. They only work on bacterial infections. Penicillins are antibiotics. They are synthesized, originally they were synthesized through bread mold fungus. And two good examples, well, since we're talking about penicillins, there would be one example right there, just straight up penicillin. But amoxicillin is another really good example. Amoxicillin is spelled Amoxicillin. Now, antibiotics are amazing, but we are developing bacteria that are, we call them the superbugs. They are evolving immunity to these antibiotics. So there are several strains of bacterial infections that are quickly becoming resistant to even the strongest antibiotics that we can offer. The cause is for a variety of reasons. We could talk about giving the over-giving of antibiotics to our livestock. We could be talking about the overprescription of antibiotics for conditions that don't warrant it. But for whatever reason, we are developing superbugs that are resistant to even the strongest antibiotics that we have. So pretty soon, the antibiotics that we use today will no longer be effective. We're going to have to start looking for other treatments to treat these bacterial infections. One of the most common, one of the most well-known of the antibiotic-resistant infections is MRSA, M-R-S-A. MRSA stands for Moxicillin-resistant Staphylococcus aureus. It's a staph infection that is resistant to the antibiotic that we normally would use to treat it, which is moxicillin. All right. That's about all I have for those. We're going to move on to our next drug category. These are analgesics, sedatives, and hypnotics. Now, these are three totally different categories. So let's break these down. Analgesics, we mentioned at the beginning, these are pain-relieving medications. Analgesia is a without pain condition. Sedatives, like to make someone sedated, calm you down. And hypnotics, don't think of it like swinging the pocket watch trying to hypnotize you. Hypnotics help a person sleep. So when we look at analgesics, we usually classify them as opioid or non-opioid. Opioid analgesics are controlled substances, so prescription only. They include natural opium alkaloids such as morphine and codeine. All right, so morphine and codeine are natural opium alkaloids. We also have synthetic opioids, for example, Demerol. Demerol is spelled Demerol. Demerol. Now, I'm sure we are aware of the opioid crisis going on, right? The opioid epidemic. The downside to opioids is that the body will develop a tolerance, and it will develop a tolerance rather quickly, which means very quickly it will take more and more of the drug to get the same analgesic effect. Eventually, you will be consuming so much of this morphine that it will start crashing the way the body works. So we're looking at things like morphine, Percocet, OxyContin, Dilaudid, Tylenol with codeine, Vicodin. A lot of these are street level drugs, but guys, these are prescription drugs, right? These have to be prescribed by a doctor. These are controlled substances. We also have non-opioid analgesics. So these would be pain relievers that do not have morphine as one of their active ingredients, whether natural or synthetic. Non-opioid analgesics, many of them are available over the counter. So we're talking about Tylenol, we're talking about Excedrin, we're talking about aspirin, right? I don't know if any of you guys are old enough to remember Anacin. Anacin was like a Tylenol, acetaminophen-based drug. They think they stopped making it back in the 70s or 80s. Anacin was a while ago. But non-opioid analgesics, generally these are over the counter. We're talking about like Tylenol, Motrin, Aleve, aspirin, that kind of stuff, that kind of pain reliever. All right, I'm flipping through. We've got several categories that I just don't have highlights for, so I don't want to spend a whole lot of time going over them if I don't, have anything really important to say about it. But your drug packet will also give you a little section on drug abuse. So it will talk about amphetamines, marijuana, cocaine, and hallucinogens. Very brief, though. It doesn't really talk much about it, but it does, include it on there. It also gives you a section on vitamins and minerals. It is important that we know if a client is taking vitamin supplements or mineral supplements, mainly because some vitamin supplements can affect the way drugs are metabolized. So we need to understand everything the client is taking so that if they're taking a supplement, say, that makes their blood pressure medicine ineffective, it needs to be brought to their attention so their doctor can change up their prescription, or so they can stop taking a supplement and take something else instead. It also gives you another really nice chart, like a really nice table that breaks down different vitamins and minerals and what those vitamins are for, where you can get those vitamins and minerals in a food source. So which ones come from animals, which ones come from plants, and then what kind of conditions will be caused by a deficiency of that vitamin or mineral. Again, this is a reference. This is not something that I expect you to memorize all of. We're not nutritionists here. We're massage therapists. The other thing that I will tell you guys is in the real world, when someone gives you their intake form and you're reading it over and you see a drug that you have never heard of before, number one, there is no shame in asking. Oh, it says here that you're on Lipitor. What is Lipitor for? And they'll tell you. Also, there is no shame in the Google game, guys. You can Google it. Everybody does it. Doctors do it. It's fine. It's not cheating. You are not expected to hold all this information just in your head, knowing every drug and interaction and what it's doing. No. Google is your friend. Now, I need you to understand the basics here so we can pass the test, but in the real world, you guys will have Google. You're not expected to memorize all of these drugs and all the possible interactions that they may create. Your pharmacology packet will conclude by giving you a nice section on herbs and supplements. So we'll talk about herbalism, how herbs are the basis of modern medicine. Many European doctors will prescribe herbs much more readily than they will prescribe them in the United States. They're not seen as alternative medicine. It's more mainstream to give someone an herbal remedy. It also will give you another table. This thing loves tables. That will list out specific herbs, their uses, and their side effects. So if you have a client who, is developing an infection, you could say, oh, well, you should take some echinacea. Echinacea has an anti-infective property. Very rare side effects as well. So really,
So,
really.
I have a question.
Yeah.
Sorry.
Yeah.
So can we recommend like herbs and oils to clients? I mean, that's
It's
something that you had just said. Like you could say that it might help them, but
it gets dicey because we aren't allowed to prescribe.
right.
So it's all in the way that it's delivered.
Okay.
Because if you just come out and say like, oh, Lois, you have an infection, you should take echinacea. Well, that's a prescription. But what I could say is, oh, you have an infection? Last year I had an infection. I took echinacea. It worked wonders for me. That was not a prescription. That was just me telling you, last year this is what I had and this is what I did, and it worked. So you want to be very, very careful. Tread carefully around that stuff. Now, remember, what you are allowed to do is related to your scope of practice. Scope of practice is related to education. So if you go to school and get, a certification or a registration in nutrition or in herbal therapy, then your scope of practice has changed. So for example, I am a certified yoga instructor. I don't know if you guys knew that or not, but surprise, I'm a yoga instructor. Because I'm a yoga instructor, I can tell my clients, you need to do this yoga pose, and this yoga pose, because they target these muscles and these are the effects that they have. I am qualified to tell someone, this is what yoga will do for you. If I was not a certified yoga instructor, I could not do that. That is outside my scope of practice. So as you add education and you add registrations or certifications or licenses on top of your resume, what you are allowed to do will expand. So if herbal remedies are something that you're really interested in, I would take some kind of course and get some kind of documentation, whether that's a registration or a certificate or something that says you know what you're talking about. If you can justify it, they can't get you for anything. They can't get you for any wrongdoing. That's what I would recommend. That's it. I made it through the whole packet. Now, obviously, you guys, I did skip around quite a bit, but I got you guys the highlights. I got you guys the main ones that you'll need to know. So there is a pharmacology Kahoot posted to MindTap that I created the other day. I've also put up, what else did I do? I did the pharmacology packet for you guys to get. You could print it or save it as a PDF. I gave you guys the pharmacology Kahoot and then the pharmacology final exam. I believe, if I'm not mistaken, that I opened that up. You shouldn't have like a time limit or anything on it because that one is pretty long. But you guys have been doing a really, really, really good job with the online thing so far. I'm really impressed with this whole group. So as always, if you guys have any problems or any questions, you guys know how to get in touch with me. I'm only here to help. So if you guys, reach out to me, I'll do anything I can to help you out. Well, that's
I
wrapping
do
us
have
up.
a question.
Yes, ma'am.
Sorry. So I went to sign on to MindTap today and it said that my trial was done. And I went through and I tried to put the code back in and everything. I think you sent out an email like talking about this, but I can't find it anywhere. I
So-
don't know where or if I accidentally deleted it or what happened. So I'm sorry
here's-
that you're a
So
broken
here's the situation. When MindTap, when the whole pandemic thing happened, MindTap basically opened themselves up to every school that had gone online, whether you paid for it or not. Like everybody has access to this. But the way that they did that, their mechanism for doing that, basically everybody gets a 2-week trial, but then
Okay.
that 2-week trial, you just renew it again and again and again. And until the pandemic stops, they will just continue renewing those things. So you shouldn't have to re-enter a code or anything. On the left-hand side of the screen, there should be like a yellow button. It says Start Free Trial. You just click that button and it should just roll you into another subscription for 2 weeks. You may have to do that every 2 weeks, but you should not ever, I want to be very clear on this. You should not ever have to pay for MindTap. They have opened it up to us for free for everyone for the entire pandemic. So if it's asking you for a credit card number or anything, you're in the wrong place. Back out of it. Do not pay. Do not pay for MindTap. We get it for free. You may just have to renew your free trial. Now, I have already had students who've had to do this, and we checked when they renewed their trial, they kept all of their grades in progress. So it did not cause any disruption. My heart sank when I thought, oh my God, am I going to have to transfer everybody's grades over every 2 weeks? That's insane. But no, it just carried everything forward. So
Okay.
just,
And where did you say, because it's allowing me to, wait, did it go? No. I'll figure it out. But if I just have to renew, then I'll just renew it. And if not,
It's just a small section on the left-hand side,
yeah, it's a small button.
and then it should have like the orange, a little orange thing saying renew, or it's like a pop-up that sometimes comes up even. No, you have nothing there? Maybe go back out and try to come back in and see what it does.
is it on like the main page?
Yeah, right after you sign in, it'll say that you need to renew it.
Yeah, it's not showing up for me.
So, Questy, I just
Yeah.
emailed you. I just emailed you that thing again from Cengage, like the instructions for renewing it. I just sent it to you again. It's in your inbox. Look at.
Okay, thanks so much. I'll figure it out. If not, then I can chat with someone and
But
figure
on
it
the
out.
email, essentially, it's under step 2. That's where you're looking for.
Okay. Well, cool. I won't take anyone's time, any more time. I'll figure this out and I'll email you.
It's fine. If you have any problems, you can give me a call or shoot me an email, and I'll try to help you through it. Okay.
Okay, great. Thanks.
Awesome.
I have a
Hey,
question.
Dave, you know that? Go ahead.
Sandra, go ahead.
Yeah, in chapter 22, we don't have a workbook to do it.
I will upload that. Did I forget to do it?
Oh, okay. Because I see the final, before this final exam, we have the Florida law and then pharmacology, but I don't see that we have a workbook.
I'll upload it today. I'm sorry about that. I'll get it
Okay.
taken care of.
Thank you.
Yep. Who else had a question? There was somebody else.
Dave, I just want to make sure you know it's me.
Caller 1?
I'm on the call. I don't know if it says it's not.
Caller 1, who are you?
Chelsea Marcinick.
Awesome.
Thank you. Sorry, I'm at work, so I'm like trying to do both things at once.
No, it's fine. No, I totally understand.
Thank you.
I just want to make sure you get credit for being here. That was my thing. So, All right, so does anybody have any questions over what we've gone over today? Cool. Well, you guys know how to get at me. If you have any questions, please enjoy the rest of your afternoon. And I will see all of you guys at 10 a.m. on Thursday.
Thank you.
My pleasure. You guys have a great night.
Thank you. Bye-bye.
Thank you.